Some big news today. Ontario is allowing over 24 healthcare providers, including dentists and massage therapists, to return to work immediately once health and safety guidelines are in place. Dentists, optometrists, massage therapists, chiropractors, physiotherapists, psychologists, physicians, dietitians, it's a long list, denturists, midwives are some of the professions included on the list that was released today. Now, it doesn't mean that all of the health services will be available today. The colleges are in the process of developing guidance to ensure high quality and safe clinical care that must be met before services can resume. And each college is going to provide advice on which services can or should be provided virtually. I don't know about you. I've been hearing from dentist's office, orthodontist's office about how they've been preparing, and people are sort of keeping us very up to date through email. Well, joining us to talk about what it looks like in getting prepared to go back is a great friend of the Nightside, Dr. Stephen Mulholland, founder of Spa Medica and one of Canada's top cosmetic plastic surgeons. Dr. Mulholland, welcome back.
Barb, good to hear you again. How are you?
I'm good, thank you. What have things been like for you the last couple of months? How long have you been closed? How's it been going?
Well, obviously it's been an unprecedented worldwide pandemic, and most practices like mine have spent the last 10 weeks preparing for what would be the new reality. And, your comments at the opening are exactly right. The colleges have released physicians to provide non-essential services, and that would include standard medical care. And then, of course, in my particular specialty would be non-emergent services, like cosmetic treatments. And so it's not business as usual. We've had to completely redefine the business and how it works, from virtual consults to virtual pre-ops to virtual preparedness, rebuild in the clinic to respect physical distancing, the use of plexiglass throughout the clinic. The providers are all in their personal protective equipment. Patients need to come in a mask. It's 6-foot distancing. Everything's EMR. No more paper charts. No more coffees. No more cappuccinos. No more magazines. Enhanced sanitation and sterilization. And the real crux of the matter, when you get in that 1-foot zone and you're getting your Botox or your filler or your photofacial or your hair removal treatments or your cool sculpting, the real popular non-invasive treatments are still going to be popular, just like getting your hair done. It's got to be done with extreme safety. So there's been innovation with this safe filter. It's a filter you would think sort of like you're scuba diving and you're under the water. You're inspiring completely purified, virus-free, atmospheric air, and then you're expiring completely filtered, so both the technician and the patient are safe. And so for those patients that are coming that are typically used to walking into a day spa or a local Botox shop, it'll be completely different. A lot of those businesses may not still be open. For someone like myself or colleagues like myself as a surgeon, we've been used to universal precautions. We're used to intubation and protecting against hepatitis C and HIV. So going to your surgeon's office for your non-invasive treatments, it'll seem like, wow, I'm going in for Botox, but they're treating me like I'm getting an open surgery. And that's the way it's got to be, because this is a very highly contagious virus. And above all else, we've got to protect patient safety and staff safety. And that's been the last 10 weeks. But most centers that were already in that mode have just adapted their operating room experience to their Botox experience.
Have you and have other clinics, whether it be a physician who's just practicing family medicine, a dentist, or someone like yourself who is a physician practicing cosmetic plastic surgery and all other kinds of services, do you get guidance from someone in terms of how you go about outfitting your office, or do you have to do that research on your own? How does that work?
No, that's an excellent question, and we're quite lucky in Canada because we're very regulated, as we should be, by both the Ministry of Health, and the Ministry of Health's been very good about a staged approach, and there's multiple hundreds of pages of guidance documents on how to restart your practice. A lot of them, to be honest, are developed for family physicians who never had to think like this as a family physician. Again, as the owner of a surgery center where universal precautions and inhalational protection airborne protection's always been a part of our routine. The guidance documents are helpful that we stay compliant, but in many cases we even get more intensely focused on safety than the guidance documents. So the college has been very good. The Ministry of Health has been very good. I think the consumer that is thinking of restarting their cosmetic treatments, they put their Botox on hold, their hairdresser on hold, their nail care on hold. They need to be very cautious to ensure the center they select is truly ready and prepared to protect their safety from this novel coronavirus.
Well, the kind of work that you do is, I believe, for the most part, very hands-on, although you talked about virtual consultations. Have there been any things that you have implemented throughout this that will continue in a virtual manner?
It's interesting. Beginning of this epidemic in March, I completely launched a whole new website. SpaMedica.com is completely different. There are now 4 virtual consult portals. You can upload your information and photos. In fact, I don't see returning to a first consultation in person. There's no need. And so we do our first screening consultations virtual. I do the second consultation virtual. We do the preoperative consenting virtual. So when the patient comes in, we want to minimize contact time with staff and staff contact time with patients. And so there's no aggregation in waiting rooms. You're at a screening center even before you get into the clinic, and then you're escorted right to the safety and privacy of your own room. And so I see most clients really like the virtual environment, the platforms like GoToMeeting and DoxyMe. You can really, I don't have to look inside an organ and see how the heart is functioning. I don't have to do really any tests. I just have to look at the patient, ask them to pull this, lift that. We can do virtual imaging on noses and bodies. And so there's been a broad adoption over the past 10 to 12 weeks, and it's forced us to offer these educational and pre-treatment virtual environments, and it's a really high-quality experience. In fact, most patients book their treatment, whether it's surgical or non-surgical, right out of their consultation with the surgeon after being screened by the nurse coordinator.
It's so interesting because I think that many businesses have found there are certain aspects, as it seems to be in your case, that they've been forced to put into place different measures, but that have proven to help them run their business more efficiently. Is that how you would describe that whole?
I would say absolutely. Because I do a lot of facelifts and sort of bigger procedures like that, probably 25% of my patients would come from Saskatchewan or Manitoba or Halifax. And so we'd always offer a virtual opportunity. We've just opened that virtual door on higher tech, well-streamed platforms to even someone who might be living in Yorkville, 1 block away. There's no need to put the patient at risk and the staff at risk with this COVID-19 when it can all be done virtually and ascertain the outcome the patient wants. And so ultimately, I can't run my entire business without putting my hands on the patient. But that's the least risky part of it because we have so many great tools and protective barriers and high-tech ways to filter atmospheric air. We just want to limit that contact to the time of treatment to minimize the need to come back and forth 2 or 3 times as patients used to have to. So we can just get right to the treatment, and they can have their treatment done efficiently and exit the clinic safely.
Now, you mentioned your staff. How do you approach that with your staff about reopening, and have they come forward with any concerns? Or, as you say, the environment you work in is a very sanitized environment anyway. What has that been like?
Well, I would say, Barb, that the operating room staff on the second floor, they're used to universal precautions, and so this is just another inhalational precaution they need to take. A lot of my nurses do work and have worked part-time at UHN, Toronto General, Toronto Western, so they know exactly what's going on. So there's less apprehension or fear. But the medical spa environment, there's a lot of fear for the young girls that work in there, and so a lot of the last 10 weeks have been getting them prepared, getting them educated, make sure they know how to take on and off their protective equipment. 10 weeks ago wasn't readily available, and you wouldn't want to take it away from the hospital environment that was preparing to maybe have a surge of patients. But now without a surge of patients, there's lots of excellent PPE. And so a lot of it is not just preparing for patient safety. They expect that, and they're going to get that. It's been getting staff confident that they can safely engage with patients. And most of them are actually behind plexiglass the whole time. It's all done, all the EMR, electronic medical records, is on a tablet. There's no more paper charts. And so the risk of fomite, of a surface like a cell phone no longer allowed, or a paper chart, no longer part of the dynamic. So it's been a complete rework of the patient experience, all designed for two things: patient safety and staff safety.
Yeah. Do you have a backlog? You must have a backlog of people who were booked for things for the last 10 weeks.
Well, it's interesting. This is 25 years I've been doing this, and we've had 5 what I would call monumental shifts in consumer and patient thinking. 1999, and I'm not comparing it to a pandemic, but 1999, the dot-com crash, the Y2K, there was a lot of fear the 2 months leading up to the end of the year, but still, cosmetic medicine was popular. We had 9/11. That was abrupt, horrible time for 3-4 months. No one was doing anything, but cosmetic medicine came back quickly. Not many other places in North America experienced SARS, but we did in Toronto, and I did have a screening center outside the clinic. We had to take temperatures. We had to do screening calls and questions just like we do now, and if they had a fever or they answered yes to any of the questions, they couldn't come in, just like we're doing now. 2008, 9, 10, the economic crisis, there was a lot less disposable cash. If you recall, we were upwards of 22% unemployment 18 months after 2008, not dissimilar to now. And in each of those environments, there's always patients that want to look their best. And so this is kind of like SARS, a horrible virus that kills people, meets the 2008, 9, 10 economic crisis. So I think that people always want to look their best. Maybe they're not going to still do the big facelift, but they'll still want to do their Botox, their photofacials. They want their skin to look good. And I think they can feel reassured that it's a very, very safe environment to get something done.
All right. We always appreciate having you on. Do you have an estimated date, or when are you back up and running? Do you have to wait for some kind of approval?
As of yesterday at around 10 o'clock at night, the Ministry of Health rescinded the Article 2 restriction. And so now it's available on the Ministry of Health website that all physicians, dentists, oral surgeons, chiropractors, massage therapy, IVF centers, colonoscopy centers are now open for business. Now, if they have been prepared and everyone's staff and patients are educated what needs to happen, there are centers that are starting to operate. So we're starting, as of Friday, we're doing non-invasive treatments in the medical spa. And as of next week, yeah, you're right, I've got 2 months of April and May that were rescheduled, and a bunch of people that always wanted to do something in summer. So cosmetic medicine is a luxury item, and it helps people feel good, and God knows we all need a reason to feel good, so it's going to be a busy summer for me.
Dr. Stephen Mulholland, great to have you on. Thank you.
Good talking to you, Barb.
All right, he's the founder of Spa Medica.
This News Talk 1010 podcast was brought to you by PocketEmploymentLawyer.ca. Wrongfully dismissed, changes made to your job, lowballed on severance? Find out if you have a case before you call a lawyer. Go to PocketEmploymentLawyer.ca.